With over 5,000 Nigerian physicians in the Americas alone, Nigeria's healthcare delivery system should not have been in the stage it is today. It is also on record that there is virtually no hospital in the United Kingdom that you will not find a Nigerian healthcare professional. More so, even across Europe and other continents. With these amazing healthcare professionals dotted around the globe, Nigeria is expected to lead Sub-Saharan Africa in healthcare delivery. On the Diaspora this week, we are engaging with some members of the Association of Nigerian Physicians in the Americas, ANPA, on their mission and vision for a healthy Nigeria and a healthy world. We also have an interview with a diasporan on the importance of maximizing technology in multimedia education. And of course, do not forget our Diaspora of the Moment. This is your favorite show, The Diaspora, and I am your host, Shaliwa Ajila. Please stay with us. Let's begin our conversation with Dr. Chinyere, President, Association of Nigerian Physicians in the Americas, ANPA.
ANPA is the Association of Nigerian Physicians in the Americas. It's a 501(c) non-for-profit entity that was initiated in 1995, so it's going on its 28th year. Its vision is a healthier Nigeria and a healthier world. Goals include being able to foster professional development amongst Nigerian physicians, to promote professionalism while evaluating health and diseases, to provide an opportunity for research in the international community, and to develop practical solutions to healthcare problems as they arise. So ANPA was established in 1995. It was initiated by our founder, who was noted to be identified as Dr. Acha Emeruwa in 1995, and has grown from that to currently its current organization, which represents the interest of over 5,000 physicians within the diaspora. Currently, what ANPA has done towards national development is a myriad of things. For instance, in the past decade, ANPA was involved in reevaluating the medical curriculum at the time of its revision. ANPA is involved in national disasters, including the Ebola epidemic. When it occurred, it was very closely involved in the initiation, the response, and the recovery efforts at the time of the Ebola epidemic. Subsequently, also in the earthquake in Haiti, ANPA was integrally involved in the Haiti earthquake by provision of support, subsistence, and recovery at the time of the Haiti epidemic. In the COVID pandemic, ANPA was involved in providing over $100,000 worth of PPE to needed and necessary areas, in addition to ongoing education, health literacy, communication, and transfer of information to the necessary stakeholders, including the formation of a COVID response team that involves the states and the stakeholders in the highly affected areas. But has also been involved with their neighbors coming back home to Nigeria and involving themselves in medical entrepreneurship. You may all be very well-versed or familiar with several ANPA members who have established very robust, high-quality, high-volume healthcare delivery systems here in the different geopolitical areas. So, moving forward to improve healthcare in Nigeria, I mean, that the sky is the limit. ANPA would like to be more present as it's going into its third decade in being able to provide cost-effective, efficient healthcare solutions to the large population. It's needed, and there's no time better than now. ANPA is involved in providing tele-mentoring projects, which would like to be started coming in this quarter in multiple hubs where we'll have experts from the United States to be able to perform distance education, to have capacity building for there to be care delivery in the area that we live in, the areas that the patients live in, to be able to extend their ability to tackle some of the commoner complicated diseases, including primary care. And so having a physical presence within the country would help us to be able to not only get into the communities and perform a community assessment to understand where the gaps are, but then be able to help create and craft and work with the local providers and leadership to create solutions that are by them, are with them, and then are enabled and supported by resources we're able to engage by view of us being diaspora physicians who are currently functioning in that capacity. Nigerian physicians in the Americas are very interested and willing to participating, giving their time and energy towards solving the healthcare issues, advocating for the necessary changes that would be required to help our healthcare to become the best that it could be, knowing that Nigeria has very passionate and dedicated professionals that are interested in doing that. This would require us being able to be involved not only on the hands-on solution standpoint, but also in the healthcare advocacy, healthcare policy, healthcare financing viewpoint, because these are the tools that are going to allow the healthcare then to be able to be delivered not just to some of us who can afford it, but to all of us who are entitled to it. So AMPA is very interested in working with the Nigerians in Diaspora Commission, the Federal Ministries of Health, healthcare leadership, experts, on-ground members, non-governmental organizations, to be able to craft an effective healthcare delivery system in line in the vision of AMPA and as all of us. A healthier Nigeria is a healthier world. To be able to use innovative solutions to cost-effectively solve the problems involved in healthcare, as has been done, but even more intricately by being involved, by coming on ground with an increasing presence in the nation to explain, express, educate, participate, and collaborate to have long-lasting, sustainable solutions. This includes being able to advise on and create a very aggressive campaign for healthcare literacy to allow us to be able to have the populace to understand that as we try and improve things by working together and developing a strong framework, there's also a portion that could be done by the individual. Healthier lifestyles, healthy eating, exercise, understanding and preventative actions towards chronic diseases that will be helpful in being able to have all opportunities towards actualizing the goals.
Many thanks, Dr. Chinyere, for your leadership. Next is Dr. Bamidele Ekusomi, Chairman, Medical Committee of Association of Nigerian Physicians in the United States.
AMPA's national aim is a healthier Nigeria in a healthier world. We do know that Nigeria has had a lot and continues to have a lot of medical problems. And since healthcare involves a lot of other things, including infrastructural development and working and enabling environment, AMPA decided years ago to do what they can do to help, while urging the government to be good and continue to serve the people. So AMPA began with a medical mission, which graduated and evolved into medical, dental, surgical, ophthalmological missions. And it has become one of the focus of AMPA service to humanity. Yes, AMPA mission involves seeing patients, doing surgical procedures, dental procedures, ophthalmological procedures, and health education. AMPA is also involved in advocacy during the mission, in which we visit government agencies and government headquarters in various fields, legislators, and advocating for good governance and good health care provisions for the entire community in Nigeria. AMPA has, in the last several years, been trying to get involved with non-governmental organizations and other private individuals who are willing to expand healthcare access in Nigeria. This, we think, will help the government of the day to give better health care to the citizens of Nigeria. AMPA has also been advocating for infrastructural provision, and that goes with the aim of ensuring that the government of Nigeria gives adequate facilities in terms of electricity, roads, and security. Because without all this, healthcare provision is going to be hampered significantly.
Dr. Stanley Okoro is a plastic and reconstructive surgeon based in Atlanta, Georgia, United States.
So AMPA Foundation is the financial arm of AMPA. Our goal is very simple: to finance and support the vision and mission of AMPA, which is a healthier Nigeria in a healthier world. How does that relate to the national development of Nigeria? Of course, going back to AMPA vision and mission, a healthier Nigeria in a healthier world, we need to make sure we can finance that vision. I've always said we are not in it for the money, but without the money, we are not in it. So that's what the AMPA Foundation goals are, to make sure that we have the financial strength to make AMPA financially independent so we can actually meet those goals. Well, the contribution for AMPA Foundation in the healthcare development in Nigeria is also very simple. Our president would like to extend all the vision that we have for AMPA into Nigeria, and we have to finance that. With our strategic partners, we can actually realize this goal by making sure AMPA meets its mission and vision, and that requires financing in the local, national, and international level. So our AMPA Foundation will be with AMPA every step of the way. As a Nigerian doctor who practices in the US, as most people probably know, that we are experiencing a brain drain. We in AMPA, we're trying to turn that into a brain gain. Look, for example, myself, I'm a plastic surgeon, and I have now returned and opened a practice in Abuja and Lagos, Nigeria, practicing plastic surgery. I'm contributing and inviting my friends to come home and join me. What AMPA and AMPA Foundation is doing is to create a soft landing for our members and encouraging them to come back and practice. This coming Saturday, I'm doing a webinar on how to practice in Nigeria as a diasporan, to show them all of the steps that I've taken, all the things that you have to do, the rules you have to follow. So with that, we can actually bring our people back home. There are a lot of things, wonderful things happening in Nigeria, but people don't know about it. So that's what AMPA and AMPA Foundation is we're going to highlight that and create the opportunity for Nigerians in diaspora to come back home and bring all that knowledge and all that skills back to Nigeria. One of the other things that the AMPA Foundation and AMPA is doing is to really invest in the infrastructure of the healthcare sector. So we're going to help support people who are trying to come back to Nigeria to bring that knowledge back. We're going to help train the trainers and make sure that healthcare access is there for our population. That's what AMPA and AMPA Foundation is going to be doing in Nigeria.
Kudos to AMPA. More impacts in the Nigerian health sector. Let's join Boya Linko for some messages.
Not so fast.
Look, I'm tired. I want to check out of this country for greener pastures.
Just calm down for a moment. Please sit down. Do you have a job where you're going to?
No, but someone is arranging,
Listen, Alinko. Checking out of this country without proper planning means one thing. Unimaginable begin. You know, I've been in the diaspora, but legitimately doing great things at home and abroad. As I've been saying, without the proper footing abroad, the risk is not worth it. Listen, Alinko, it's better to be home than be trapped abroad, or even end up in prison.
If you must travel, please travel legitimately. Now, Mr. Idon Akugon is a Nigerian based in the United States. He is concerned with leveraging on technology to maximize the benefits of e-learning in Nigerian universities, polytechnics, colleges of education, and secondary schools. Take a listen.
I'm here with a very talented diaspora who is passionate of giving back to his country, doing a lot of stuff in education. Can you lead us in to your project in education back home in Nigeria?
This is very exciting. I am doing something very different in education. Since 2010, I've been advocating for maximizing technology in the Nigerian classroom, in the African classroom. How can we maximize technology, multimedia in the Nigerian classroom, moving away from the usual way of using chalkboard and teacher interaction in the classroom, but using multimedia, maximizing video conferencing, PowerPoint, so that a student in the classroom can be interacting with students and teachers across the world. We did that successfully in 2013, prior to COVID-19. So today, with, of course, post-COVID-19 and the pandemic, we're doing this now with e-learning and learning management systems. We're doing that more with the colleges of education, the university system, the polytechnic system. So with my project, the e-education program, we're trying to create more awareness. How can we get more schools interacting from Sokoto to Rivers State, from Lagos to Borno, and also from Nigerian schools to schools in South Africa, schools in Nigeria to schools in the United States. That is what the program does. In November of this year, I'm having a conference who every management of tertiary institutions across the world who are listening, please, you're invited to this conference in Houston, Texas on the future of education. We're going to talk about new technologies, grants and grantmanship, security, because across northern Nigeria we've seen where kidnapping and different things have been happening across Nigeria. Well, this program is going to talk about security. How can we get students and faculty secure on our campus? Someone's going to come and talk about how we can get an app set up on everybody's cell phone, so therefore a student who is being kidnapped or something can just touch an app on his cell phone, and instead of calling police running from down the hall, you just touch the app, it will signal the police person at the nearest public safety, and they'll just realize and shut down the entire university or polytechnic. So different things. I'm just trying to give you a tidbit of what the conference is going to be about. Also, we're going to talk about different things that have to do with partnerships. How do you partner with different schools across the world? So you're invited to come for this conference. These are things that we're trying to do with my program to create a special enhancing of the system across the Nigerian tertiary system. So you see, it's not all about working with the government. Sometimes us in the diaspora, we're not looking at just the government, but we ourselves as a people, we have to find a way to help each other. Be part of the solution within your society. Everything is not about the government all the time. Sometimes we as Nigerians, we can work together, help the government, help your community to make things better as a society.
That is a good prospect for e-learning. You know, in Nigeria we talk about digital economy. Now this is digital learning, I guess.
That's right.
Right.
That's right.
So what are the prospects of this which you are doing? Moving forward, how do you look at e-learning?
Learning as it is today is we're going to move from just digital education to the metaverse. From just classroom interaction on the screen, we're going to have a situation where a student can even wear a mask, and you can be, I don't use the word magically, but you can morph yourself into a different room in Dubai and different parts of the world. So there's the options and possibilities are endless as to what you can do with technology in this world. So the world, as we look at it in the Western world and the developed world, has already moved way ahead of Africa and Nigeria. But that doesn't mean that we should continue considering where we can go from yesterday to today. We have to look at where we are today to tomorrow. And that's where e-education is coming from. We have to start planning how we can compete and surpass developed countries, whether it's China, America, and England, so that our young people, as they get to be our leaders of tomorrow, they can take care of us who are here now and make sure that our country is better off than where we are today.
That does it for today. We'll reconnect another day, and we'll be monitoring things, or we'll be monitoring things through e-learning. We'll be learning, even this interview is going to be e-interview in subsequent bulletins. Thank you.
Thank you, Mr. Akugun, for your passion in e-learning. Now, to our diaspora of the moment. Our diaspora of the moment is Tokwe Awutono. Tokwe was born in Lagos, Nigeria, into a middle-class family. His father was a microbiologist and entrepreneur, and his mother worked at the Central Bank in Lagos, a city of 15 million. When Tokwe was 12, he witnessed his father get shot and killed in a carjacking. There was a part of me from that very early stage that wanted to redeem him, he once said. In 1996, when he was 15, he moved with his family to Atlanta. He studied computer science at the University of Georgia, then switched to business and management information. Forbes has profiled Tokwe Awutono, the 40-year-old founder and chief executive of a $3 billion worth Calendly, a monthly scheduling platform. 9 years ago, Awutono started Calendly, pouring his life savings of $200,000 into it and later quitting his job selling software for EMC. Today, the company has 10 million users and counts Lyft, Ancestry.com, Indiana University, and La-Z-Boy amongst its customers. The company's revenue last year passed $100 million, double what it booked the previous year. It could double again this year. The company, which was founded in Atlanta but no longer has any physical offices, has been profitable since 2016. Last year, it raised $350 million in funding, OpenView Venture Partners and Iconic Capital, at a price that values the business at $3 billion. That means Tokwe's majority stake is worth at least $1.4 billion after the 10% discount that Forbes applies to shares of all private companies. Tokwe is just one of 2 black tech billionaires in the United States, along with David Stewart, the 70-year-old founder of a Missouri-based IT provider, Worldwide Technology. Congratulations, Tokwe Awutono. We celebrate you as our diaspora of the moment. This week's episode of your favorite show, The Diaspora. Join us on our various media platforms and also keep a date next week. I remain your host, Shaliwa Ajila. Bye for now.